Guys, this is part 2 of Model Paper 3. You can check out the part 1 in the link given below. Injections are prepared with which solvent? Potable water, apyrogenic water, hot water, or distilled water. So the correct answer would be option B, apyrogenic water. 27th question. Calomel is mercuric oxide, magnesium chloride, mercuric chloride, or mercurous chloride. So the correct answer is mercurous chloride, option D. The drug used both as tranquilizer and antihypertensive agent is risperidone, amitriptyline, papaverine, procaine. So the answer is risperidone, A. Moving on. The percentage of simple syrup is 56% weight by weight, 33% weight by weight, 66.7% weight by weight, or 85% weight by weight. The correct answer is 66.7% weight by weight. The taste of residual chlorine by adding chlorine tablets in water is removed by adding calcium oxide, magnesium sulfate, calcium sulfate, sodium thiosulfate. The answer is option D, sodium thiosulfate, which when reacts with chlorine forms sodium bisulfate, which is an inactive salt. The next question, the education regulations are laid down by, the options are central government, state government, Pharmacy Council of India, State Pharmacy Council. So the answer is option C, Pharmacy Council of India. Which of the following drugs is an ACE inhibitor? Metoprolol, diltiazem, lisinopril, clonidine. So the answer is option C. Lisinopril is an ACE inhibitor. Silver nitrate is stored in a clean, dry white bottle, lead-free white bottle, amber-colored bottle, neutral glass bottle. So silver nitrate decomposes in the presence of sunlight, so it is stored in amber-colored bottle. Oxidation is defined as loss of electrons, loss of hydrogens, addition of oxygen, all of the above. Oxidation is all of the above. Mentioned options are true. Thirty-fifth question. A proton pump inhibitor used in duodenal ulcer is sucralfate, lansoprazole, tripotassium dicitrate or bismuthate, gelusil. So as you know, prazoles are PPIs. Lansoprazole is the correct answer. Next question. Carbimazole is a male sex hormone, antacid, antimalarial, antithyroid drug. Carbimazole is an antithyroid drug. The antidiuretic hormone is secreted from adrenal cortex, adrenal medulla, anterior pituitary, posterior pituitary. The answer is option D, posterior pituitary. ADH is secreted by posterior pituitary. Okay, now moving on to the 38th question. Disease transmitted by fomites include all except diphtheria, typhoid fever, bacillary dysentery, streptococcal infection. So, what are fomites? Fomites are non-living objects that transmits disease-causing pathogens. They are non-living objects. So, the answer for this question is streptococcal infection, which is not spread by fomites. It is rather spread by direct contact with nose and throat discharges of an infected individual or with skin lesions. That's how streptococcal infection is spread, not transmitted by fomites. Father of surgery was Aristotle, Hippocrates, Ambroise Paré, Hahnemann. The correct answer is option C, Ambroise Paré. A drug used to treat cardiac arrhythmias is cocaine, syncocaine, quinine, quinidine. The correct answer is option D, quinidine. Next question is, bentonite is used as a oxidizing agent, suspending agent, preservative, reducing agent. The answer is bentonite is used as suspending agent. Chal mugra oil is used as antileprotic, antitussive, antibiotic, antihistamine. Chal mugra oil is antileprotic. It is used as an antileprotic agent. Parenteral preparations are tested for pyrogens, hardness, alkalinity, total solids. Parenteral preparations are tested for pyrogens. The Magic Remedies Act was passed and enforced in the year 1954, 1944, 1919, 1930. Answer is option A, 1954. If 1 kg of an ointment contains 250 grams of salicylic acid, what is the percentage strength of this ointment? 25%, 2.5%, 0.25%, 250%. The answer is option A. The percentage strength is 25%. Broad spectrum antibiotic is doxycycline, furosemide, nystatin, cimetidine. Answer is among the options, the right answer is doxycycline. A calcium channel blocker used in hypertension is digoxin, reserpine, propranolol, nifedipine. So the answer is nifedipine. It's used in hypertension. It is the CCB. Epsom salt is synonym for ferrous sulfate, manganese sulfate, sodium sulfate, magnesium sulfate. Epsom salt is magnesium sulfate. The lower jaw is known as maxilla, ethmoid bone, mandible, clavicle. So the lower jaw is nothing but the mandible. Skeletal muscle relaxant is tubicurarine, propranolol, adrenaline, chloroquine. Tubicurarine is the skeletal muscle relaxant among these. Its clinical use was limited because of many side effects. Now, part 3 will be continued in the next video.